Why do humans hiccup? A closer look at an ancient reflex. Hiccups are one of the most common yet mysterious bodily functions. Almost everyone experiences them at some point in life, whether it's during a big meal after a soda or for no clear reason at all. A hiccup is a sudden involuntary contraction of the diaphragm, the muscle that separates the chest from the abdomen and plays a key role in breathing. Although hiccups are usually harmless and temporary, they have puzzled scientists and doctors for centuries. Why do humans hiccup? What causes this strange reflex, and why does it even exist? In this video, we will explore the science of hiccups, their causes, their possible evolutionary purpose, and what can be done to stop them. What is a hiccup? To understand why hiccups happen, we must first understand how they work. A hiccup begins with a spasm in the diaphragm, the large muscle located beneath the lungs. This muscle helps us breathe by contracting and relaxing. When we breathe in, the diaphragm contracts and moves downward, allowing the lungs to expand and fill with air. When we breathe out, it relaxes and moves upward, helping push air out. A hiccup occurs when the diaphragm suddenly contracts without warning. This quick contraction causes a rapid intake of air, but almost immediately after, the glottis, the space between the vocal cords, snaps shut. This creates the familiar hic sound. The entire process happens involuntarily and can repeat several times a minute until the reflex stops. Common causes of hiccups. There are many everyday causes of hiccups. Most of them are harmless and temporary, often lasting just a few minutes. Some of the most common triggers include eating too quickly or overeating. When you eat too fast or swallow too much food, you may also swallow air. This can irritate the diaphragm, leading to hiccups. Drinking carbonated beverages. Fizzy drinks contain carbon dioxide gas, which can cause your stomach to expand and put pressure on the diaphragm. Sudden changes in temperature. Drinking a cold beverage after a hot meal or experiencing a quick shift in body temperature may stimulate the nerves that control the diaphragm. Spicy foods. Spices may irritate the esophagus or stomach, triggering a reflex in the diaphragm. Stress and excitement. Emotional changes such as anxiety, nervousness, or excitement can sometimes cause hiccups. This is because strong emotions may affect the autonomic nervous system, which controls the diaphragm. Laughing or talking while eating. When you laugh or talk while chewing, you may accidentally swallow air, which can irritate the diaphragm. These types of hiccups are referred to as acute hiccups and usually go away on their own without treatment. When hiccups become a problem. While most hiccups are short-lived, some people experience persistent or chronic hiccups. Persistent hiccups last more than 48 hours, while chronic hiccups can last for months or even years. Although rare, long-term hiccups can significantly interfere with daily life, causing fatigue, sleep disruption, weight loss, and emotional stress. There are several medical conditions and factors that can cause prolonged hiccups. Nerve damage or irritation. The phrenic and vagus nerves control the diaphragm. If these nerves are irritated by a sore throat, tumor, or other conditions, it can result in chronic hiccups. Central nervous system disorders. Conditions like stroke, multiple sclerosis, brain injury, or tumors can interfere with the part of the brain that controls hiccups. Metabolic disorders. Kidney failure, diabetes, and electrolyte imbalances may also cause hiccups. Medications. Certain drugs, especially those used for anxiety, pain, or chemotherapy, can trigger hiccups in some people. In these cases, medical treatment is necessary, and doctors may use medication or other therapies to stop the hiccups. The role of the nervous system. Hiccups involve a complex reflex arc that includes the brain, diaphragm, and nerves. The vagus nerve and phrenic nerve play a crucial role in controlling the diaphragm. Any disruption in this circuit, whether physical, emotional, or chemical, can result in hiccups. Researchers believe that the hiccup reflex is located in the brainstem, the part of the brain that controls basic life functions such as heartbeat, breathing, and swallowing. The reflex may be triggered by abnormal signals or overstimulation of the nerves involved in this system. Why do hiccups exist? The exact purpose of hiccups is still unclear, but scientists have proposed several theories. Leftover evolutionary reflex. Some researchers think hiccups may be a primitive reflex left over from our evolutionary ancestors. In particular, amphibians like tadpoles use a similar mechanism to help move water across their gills. Hiccups may be a leftover trait from the time when early vertebrates used both lungs and gills to breathe. Training the breathing muscles. Another theory suggests that hiccups help develop the muscles involved in breathing during infancy. Fetuses have been observed hiccuping in the womb, possibly to help strengthen the diaphragm before birth. Preventing choking in bobbies. Some believe that hiccups may have developed as a way to prevent bobbies from choking while feeding. The sudden closure of the glottis during a hiccup could stop milk or food from entering the airway. Although these theories are interesting, none have been definitively proven. It's possible that hiccups served a purpose in early evolution but have no real use today. How to stop hiccups? There are many home remedies people use to stop hiccups. While not all of them are backed by science, some work by resetting the diaphragm or stimulating the vagus nerve. Hold your breath. Increases carbon dioxide in the blood, which may help stop the spasm. Drink a glass of cold water. May reset the diaphragm or shock the system. Eat a spoonful of sugar or honey. Stimulates the back of the throat and may interrupt the hiccup reflex. Breathe into a paper bag. Similar to holding your breath, this raises carbon dioxide levels. Pull on your tongue or gently press on your diaphragm. These methods can stimulate the vagus nerve. If hiccups last more than 48 hours or interfere with eating, sleeping, or breathing, it's important to see a doctor. Conclusion. Hiccups are a strange yet familiar experience for almost every human. While they are usually harmless and short-lived, they involve a surprisingly complex reflex arc controlled by the brain, diaphragm, and nerves. Everyday activities like eating too fast, drinking soda, or feeling stressed can trigger hiccups, but in rare cases they may be linked to serious medical conditions. Although their exact purpose remains unclear, hiccups may be a remnant of our evolutionary past. Until science uncovers the full mystery, we'll likely continue to live with the occasional hic, a tiny, odd reminder of how our bodies are wired in wonderfully complex ways.